One thing that I was taught in nursing school that I wish was taught in medical school is therapeutic communication. Hi, I'm Dr. Bryce. I'm an OBGYN resident and mom of 5 in West Virginia, and I was an RN before I went to medical school. And it's not that therapeutic communication isn't taught at all in medical school. We are taught to ask open-ended questions and to do active listening and respond, but it just wasn't emphasized the same way that it was in nursing school, and I don't think it was broken down as much. I remember doing multiple projects on it, and I've sort of asked some of the nurses that I work with now, like, did you guys, like, was this a big emphasis for you, or was it just my school? And it definitely seems to be a pattern that it's very emphasized and taught throughout nursing school, regardless of whether you went and did like an ASN or a BSN or whatever your nursing degree was. It was definitely something that is taught at most programs, as far as I can tell. And I think medical schools would really benefit if they took the way that nursing schools teach therapeutic communication and teach your patients. And the reason why I think that is because it improves patient outcomes. When we have good therapeutic communication with our patients, it allows everyone to be on the same page. It allows our patients to feel more heard and respected. And then most importantly, it leads to better patient outcomes. I'll cite some papers in the comments below so you can kind of see what I'm saying. But some of the things that we see is improved blood pressures, improved glucose control, better abilities to kind of stick with the care plan or follow the care plan. So especially if medications are being taken multiple times a day, sometimes it can be really beneficial if we've had that therapeutic communication so that the patient not only understands why we want them to do it, but they also are incentivized to be part of it because they've helped make that care plan. And so one thing, like one example of this that I can think of is that there was a patient who always really struggled at the end of the day, and we didn't really understand why she struggled. It was just very frustrating. She always sundowned, but it was really bad, like very, very bad. And finally, one of the nurses went and talked with the family and really talked with the family about like what her structure in her life was. Well, it turns out that this patient got a bath and a shower, or bath or shower, every night when she went to bed. She never bathed her whole life in the morning. And we, at that time, were giving her baths in the morning. And then all we did, because the nurse had had this communication and talked with the family and really sat down and asked open-ended questions about what her routine was, what her schedule was, and really listened and paid attention and figured out what was important to the patient and the family, this small change of being able to move her bath from the morning to the evening changed everything for that patient. She felt better throughout